1 in 10 people will develop kidney stones in their lifetime. If you're one of them, this Healthy's Kidney Stone Institute DVD will give you a broad overview of what to expect. We want you to be an informed partner in your care.
Welcome. I'm Dr. Andrew Portis, Medical Director of the Healthy's Kidney Stone Institute. At the Healthy's Kidney Stone Institute, we're excited to offer world-leading complete care to people with kidney stones. As we follow the story of one of our actual patients, we hope that you will come to understand our mission to offer a fresh start to stone formers.
Greg's story is like a lot of other people with kidney stones. One day at work, he suddenly had pain in his side and back.
And I thought, well, that's weird. I must have pulled that. And throughout, I'd say within an hour, it felt like actually felt like a vice was crushing my lower back, and I couldn't escape from it. I kept going to the bathroom, and after a while, I couldn't go anymore, and then it just kept getting worse and worse. And then finally, one of the guys at work said, you know, you look really white. You should go to the hospital. And then I thought, well, you know, I didn't know what it was, and I thought, well, maybe it's a kidney stone, because I remember my dad had had one years ago.
Greg went to the emergency room. A CT scan showed it was a kidney stone. Greg was given pain medication. Because his pain was so severe, he was then admitted to the hospital, where he could be given strong pain medication. While in the hospital, Greg passed the stone the next day. 3 years later, the same pain came back. Greg tried to take care of the pain by using over-the-counter pain pills, but it just got too hard to bear, so Greg went to the emergency room again. In the ER, Greg had another CT scan. It showed new kidney stones. A stone was stuck in his ureter. Greg's pain was controlled with medicine, and he was able to go home. This time, he went to see Dr. Andrew Portis. Dr. Portis is the medical director of the Healthy's Kidney Stone Institute at St. Joseph's Hospital in St. Paul. He's a urologic surgeon.
The Healthy's Kidney Stone Institute was started to improve the care and education given to those with kidney stones. It also supports research to find better ways to treat stone disease. The goals are to make an accurate diagnosis fast, control the pain quickly, and clear out the stones when needed. We want to discover why a patient gets stones and how to prevent them in the future. In the past, stone disease has been frustrating for both patients and their doctors. With important new developments at the Healthy's Kidney Stone Institute, we've good reasons to be optimistic. We can make a real difference for the stone patient. Treatment is much more effective, and long-term prevention is a real possibility. Patients don't have to live in fear of their stones. Greg's story is pretty common. His first painful stone passed on its own. Now he has another one. This one will likely require formal treatment. As a person who has had more than one stone, he needs definitive management and a plan for long-term prevention. Not only does he have one stone blocking the ureter and causing pain, but he has another 2 stones growing up in the kidney, which may cause problems in the future. It's always important to keep all stones in mind when planning treatment and not get overly focused on the current troublemaker.
Pain from a stone is often dramatic. It is usually severe and comes on quickly. It is usually bad enough that people will seek medical care. People with recurrent stones need to know that their symptoms can be misleading. Severity of the pain does not predict the size of the stone or whether it will pass on its own. Also, just because someone has had a stone before doesn't mean that the current pain isn't appendicitis or something else. That is why we recommend a CT scan. We want to make the right diagnosis.
The use of CT scans has been a tremendous advance for management of stone disease. The number, size, and location of all stones can be discovered in less than a minute without any intravenous or oral dye. A person with a bad stone attack is usually seen first in the emergency room. If a person has a fever and a stone that is blocking the urine flow, they need to get their kidney draining immediately. If so, this is the first priority. This doesn't fix the problem, but it buys time to allow the person to get healthy enough to allow later treatment of the stone to be safely performed.
If it isn't an emergency, the person may still be hospitalized. The most common reason is pain control. For most people, medication taken by mouth will usually be enough. If a person can be comfortable at home, that's where they should be. The best choice is outpatient care whenever possible. All patients with significant stones should be seen by a kidney stone specialist. At the Healthy's Kidney Stone Institute, we offer a rapid referral system. Our aim is to provide the best care as fast as possible.
On initial encounter with a stone specialist, a careful assessment is made taking into account the patient's present stone size, location, and number, previous stone experiences, past medical history and, of course, their preferences. At this time, a decision is made regarding necessity and timing of any intervention to remove stones.
There really is no cookbook approach to stone disease. To maximize success, it is essential to understand a patient's prior stone and general medical history and incorporate this with a plan for long-term prevention. For patients with smaller stones, which have already moved down towards the bladder, a supervised trial of passage is often recommended. It is important to confirm that the stone actually does pass by either retrieving the stone from the urine or by demonstrating its absence on a follow-up CT scan. Patients with large stones high in the kidney are not likely to pass the stone on their own. Early surgery is the best option. Greg has a less than 50% chance of passing the stone on his own. His pain was controlled with medications, but he did not want to have surgery.
For Greg, his odds of success were poor, but he was otherwise healthy and could be relied upon to seek help if necessary.
2 weeks later, Greg returned as scheduled. He had some pain and he was able to continue work. His follow-up CT scan showed that the stone had not moved and there was increasing swelling of the kidney.
Greg's stones weren't moving. We try to support patients in their efforts to avoid surgery, but not all stones will pass. If surgery is needed, the patient needs to be fully informed. The goal is to provide the treatment that is most likely to be successful in a single procedure. The right choice leads to the best long-term results.
That means the longest time without stone pain or problems. After consultation with the stone specialist, the patient should know their options, how effective they are likely to be, and what the risk factors are. Each stone and patient are unique, and treatment should always be individualized. In general, stones which are too large to pass on their own need to be broken into smaller pieces to be removed, and this can be done in different ways. A common method is to use a shockwave machine. With this treatment, it is hoped that the stone will break and that pieces of stone will pass on their own without problems. Unfortunately, not all stones break and not all pieces pass.
At the Healthiest Kidney Stone Institute, we've developed two options to shockwave treatment. With both, the patient leaves the operating room without any stone fragments to pass. That gives patients the best chance of achieving a stone-free future.
The St. Paul method is a ureteroscopic technique. A small scope is passed from below, and a laser is used to break the stone into smaller pieces. All the pieces are then removed.
For larger, more complex stones, we make a half-inch tunnel through the back down into the kidney. With this method, large stone fragments can be cleared. Both of these methods have been demonstrated to be minimally invasive and highly effective, with greater than 90% of patients having success with a single procedure.
Greg's situation was well suited for the St. Paul method. All his stones were successfully cleared. Now that Greg's stones are gone and he's feeling healthy, the focus is on long-term prevention. After having one stone, a person has a 50% chance of having another one within 7 to 10 years. Because Greg has had stones at least 4 times before, unless something changes, he is likely to form more stones in the future. He was strongly encouraged to enroll in our prevention program.
Greg's stone risks were evaluated. We did blood tests, 2 24-hour urine collections, and a food journal. Every person has their own specific risks for making stones. Collecting the urine for 24 hours is the best way to understand why a person may be making stones. It's very important that people stick to their usual diet and activities while collecting urine specimens. This way we can give the best advice about how to decrease their risks.
In Greg's case, his major stone risks were due to a high-salt diet which caused calcium to be high in the urine. This was made worse by a low urine output from not drinking enough fluids. Greg's stone risk could easily be decreased. He needs to avoid salty foods and drink lots of fluids. To help Greg, we arranged a consultation with a nutritionist. He didn't know where the excess salt in his diet was coming from. He didn't usually salt his food. It turned out that he was eating many prepared foods which were very high in sneaky salt. After making some better food choices, follow-up urine testing showed that his risk of stone formation had been greatly reduced. Today, Greg is stone-free, and like other kidney stone patients, he's learned that kidney stones are a lifelong disease and that he can actively control his fate. Greg has passed his love of sports onto his son Joe. Now he wonders whether he's passed on kidney stones as well.
I hope I don't pass this on to my son. I don't think that I will, because of all the precautions we're taking now. We've got a lot better education on stones and prevention of them. But my dad did have the kidney stones. I had them, and perhaps he may someday, but Now we're eating healthier and low in salt, and then drinking a lot more water, so hopefully he won't have to experience that kind of pain.
To make a referral or to contact the Healthiest Kidney Stone Institute, call 651-326-3830.